my name's Ben and this is
Andrew.
And today we're going to go through the pelvis. Alright, so what three bones fuse together to form the pelvis?
Iliac.
The iliac bone or the ilium, which is at the top.
Ischium bone.
The ischium, which is the base, the bottom.
And the pubic bone.
Which is in the front. Because where are your pubes?
In the front.
Good. Okay, so our three bones that fuse together to form ilium, ischium, and pubic bone. And where they all form together is in the socket, which is known as the
acetabulum.
Acetabulum. Good. Then, if we look at some major landmarks on these bones, if you go over the top of a hill, you go over the
Crest.
Good. So this is the
Iliac crest.
iliac crest. A big bump on a bone is called a
Tuberosity.
and so this tuberosity is on the
Ischium.
so it's called the
Ischial.
tuberosity. Gorgeous. What was the name of the socket?
Acetabulum.
Acetabulum. And what's this joint at the front?
Pubic symphysis.
Good. Pubic symphysis. All right. If we take this part of the pelvis, which is there, and we pull it off, if we have a look here, how do we know which surface we're looking at?
It's the medial surface because the acetabulum's on the middle.
Good. So here's our acetabulum. So that must be lateral because the head or the femur attaches. So this must be medial. Okay. So medially, we've got this thing here which is shaped like an ear. So when you're watching and listening to your AV, what's the A sound?
Audio.
Audio. So this is an ear, so that's audio. So auricular surface. So this is our auricular surface. And what does the auricular surface articulate with?
Sacrum.
Sacrum. Good. So what joint is formed between the auricular surface and the sacrum?
Sacroiliac joint.
Good. Sacroiliac joint. Then what's this bone?
Pubic bone.
What bone does this articulate with?
The other pubic bone.
The other pubic bone. And what joint is formed there?
Pubic symphysis.
Gorgeous. Pubic symphysis. Alright, if we have a look down here, in our acetabulum, so what bone connects to the acetabulum?
Femur.
Femur, and in particular the...
Head of the femur.
Good. On the head of the femur, can you see this one? We got a little fossa. So what's the name of a little fossa?
Fovea.
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 And because it's on the head, what sits on the head?
Capitis.
Good. So fovea capitis.
Capitis.
So this little fossa is called the fovea capitis. Why do we have a fovea capitis?
Secure the head of the femur in the acetabulum.
Woo! Nice answer. And it secures the head of the femur into the acetabulum via the...
Ligament of the head of the femur.
Boom! So the ligament of the head of the femur attaches to the acetabulum and into the fovea capitis to stop it from dislocating. So the hip joint is a really stable joint. Why is the hip joint stable?
Because it has a large acetabulum.
Good. Large acetabulum.
The acetabulum is facing downward.
It does.
Has large muscles surrounding
Thank
the
you.
joint.
Yes. Also, it's got strong
Ligaments.
and in particular, it has the
Ligament of the head of the femur.
shot.